So my name is Dr. Lindsay Wallace. I am a clinical health psychologist here at Medical College of Wisconsin, and I will be one of the rotation supervisors for the cancer rotation.
So my name is Dr. Maria Olex. I'm a clinical health psychologist at the Medical College of Wisconsin. I'm another supervisor on the cancer rotation. And so what we'll be doing together is pre-treatment evaluations for patients undergoing stem cell transplant.
And then you get to follow them with me when they're inpatient going through the actual transplant process. So there's a continuity of care that occurs with the BMT patients. That's a really unique experience. It's a familiar face for them to see, both in testing and then in the hospital. And it helps the team coordinate care as well.
A typical day here looks like when your patient walks in, the medical assistant will groom them, and then after that, we will go through past and present psychiatric issues, social supports, really looking at a good social history as well. The typical battery consists of a personality measure, which here we use the Milan Behavioral Medicine Diagnostic, the MBMD. We do a brief measure of cognition, so here we use the MoCA, which is the Montreal Cognitive Assessment. We also do self-report measures of depression and anxiety.
And we get consults based on anxiety, trouble sleeping, coping, end of life. So we get a really wide variety of consults going through recovery from radiation chemo or sometimes into survivorship. So outside of just doing brief interventions with inpatient consults, we work a lot with other disciplines on the different units.
On Tuesday mornings from 8 to 9, we also have the BMT multidisciplinary rounds, and this is an opportunity for everyone on the patient's team to gather. That includes the oncologist, the attendings, psychologists, social work, and anyone else that's on the team to really come together to talk about upcoming transplants as well as those that are currently hospitalized. This is an opportunity for us as psychologists to really advocate for patient needs, as well as to speak up when we feel like someone's at high risk of developing any sort of psychiatric symptoms.
My philosophy in working and teaching with you guys is just to kind of meet you where you're at, and I really take a developmental approach where we start off by having you kind of observe and follow me with different consults and follow-ups, and then we kind of reverse it and I'll follow you, you take the lead. I'm somebody that, yes, we have a formal hour of supervision every week, but my door is always open, and I think with inpatient work, it ends up being a lot of curbside.
So you can expect to have at least 1 to 2 patients per week. Although it sounds like a very low number, usually it takes about a week or so to compile all the results of the testing and to really write out a thorough evaluation.
My favorite part about this rotation and teaching residents has been seeing kind of the evolution and them realizing it doesn't have to be this dark, scary place. There's a ton of resilience that you see in this patient population, and I think a lot of people walk away with a different perspective, and so I'm hoping that you guys do the